Hi guys, and welcome back to my channel, or if you're new here, welcome. So today's video is going to be talking about my daughter's heart condition. Now I've mentioned this quite a lot over on my Instagram about it. I haven't really gone into too much detail. I felt like I really wanted to get out the woods with it with Isla. We only found out 2 months ago. It's been such a whirlwind, but I wanted to get past the worst of it before I put things out there and started sharing it with everybody. But now Isla's had her operation and all is well, I feel like I'm in a safer place to share it with you guys. So I did a separate video on Isla's allergies and the issues she's had there, and I did allude to on that one about her heart condition. I started that before I really knew that there was something more serious going on. But long story short is we went in to see the consultant because Isla was really chesty all the time and I assumed she had asthma, and we went to see this paediatrician that specialises in allergies, and he said that he doesn't think, well, he possibly could have asthma, but he doesn't think that's the issue. He believes that it's the reflux, but I've put that all in that video. But whilst he was doing her checkup there, he noticed she had a heart murmur. So he referred us over to the paediatric cardiologist at the hospital, and we saw him for initial consultation just so he could double confirm there was a heart murmur and she would need an echo, which he did. And at this stage, everyone, well I say everyone, the two doctors were basically saying it's probably a hole in the heart, if anything. They're quite common-ish. Not to, there's always leveling degrees of severity with these holes in the hearts. Obviously it's horrible finding out. I cried when I found out it may have been that. But they're quite common, and I'll say normally, it's really hard to normalise these conditions, but the way they made out is that she could have a hole in the heart, but it might not be anything to really worry about. It will resolve itself. She may just need a check-up to make sure she's going in the right direction. So it came round to having her echocardiogram, and we went in there, and I went in there with thinking the worst case scenario, they're going to tell me she's got a little hole in the heart and they may need to review in a year's time to see how it's going. So yeah, she was absolutely fantastic when she had her echo. She's been so good with her scans. She just lays there, watches the doctor, just, you know, she's just so good, and they all praise how still and good she is with these scans. And I didn't go in there with, well, it made me more nervous than the other scans she had, but I still had the hope it wasn't going to be anything too bad, because that's what they kind of led me to believe. Not that they were trying to be misleading, they didn't know at the time how bad it was. They're just going off like common denominator of what it could be. So we were in there, everything was fine, the doctor finished, and we were under the impression that it was all gonna be fine. So Adam said, oh yeah, did it all look good then, all alright? And he was like, you guys need to take a seat. At that point, we knew, I mean, I knew something was bad, but I thought maybe it was a bit more worse, hole in the heart, something like that. But yeah, he turned round to us and basically explained that what he found, even he was shocked. He didn't expect he was going to find. So she's got something called a PDA, or patent Ductus Arteriosus, I believe that's how you pronounce it. I will put all the spellings down below, which is, I will link medical links down below so you can read into more detail about it. But when babies are in utero, there's a vessel that is open between, I think it's between the chambers, or it stays open because obviously they're getting the blood and every oxygen from the placenta, and it generally closes a few days after birth. Worst case scenarios normally takes a year. Quite common in premature babies. Isla wasn't prem, she was 2 weeks over. So she had no risk indicators of her having this, and it's a congenital heart defect. I don't believe it's hereditary. I've not, as far as I'm aware, I haven't got any heart conditions like that, neither has Adam. So yeah, it's a bit of a shock. And he basically said she's 2 years old. If it hasn't closed up by now, it's not going to on its own, and now it poses risks. So from the scan, he could already tell that he was putting strain on the left side of the heart. It also can put strain on the lungs because the oxygenated I think this is right, but please don't come for me, because it's just, obviously I'm just trying to take in all these medical things and it's overwhelming. But it like sends too much oxygenated blood to the lungs, and that can cause problems breathing, and also it puts them at risk of carditis, which is a heart infection. So yeah, yeah, it was very overwhelming at the time. We were a bit in shock. We just came out a bit numb from that appointment. We just weren't expecting it, and the cardiologist at the time referred us to a specialist in London who's meant to like be the best in the country. He's absolutely fantastic, and so we waited for a referral and a consultation with him. So that was like a week or so's turnaround to have that appointment. So we went into London and saw this specialist, and as we were waiting for this to do the echo with him so he can look and give his own opinion and advice, he was basically saying, I've read the notes, and from what he could read in the notes, he thought it was quite a minor PDA, and his advice was she will need something doing about it eventually, but if it's minor then maybe we can wait until she's a bit older, but eventually she will need to have something done, because you know there are risks there of the valve still being open. And we were like, okay, well that might be good, because you know we might be able to wait until she's a bit older, and you know that might be a bit nicer for her if she's a bit older, recovery and things like that, we were thinking at the time. And then when we finally got into the room and did the scan, he was doing it, and then all of a sudden he was like, that is not a minor PDA. He was like, that is a severe PDA. He was like, I don't need to do any more of this echo to know that she needs to get this procedure, like this surgery done immediately. He basically said to us at this point, he was like, you need to get it done before winter. Obviously it's colder, we're in risk of getting illnesses and infections, and he was like, you need to get it done before winter. He said you need to get it done within you know, if not then, within the next 6 months. He said something about the blood flow, and I can't really remember the terminology, but he said that it's borderline, I won't say dangerous, but borderline a concern now. He said in 6 months time it could double and be a serious issue. So we were like, okay. So that was Wednesday and then she got booked in for her operation on the Monday, so we didn't even have a week's turnaround to really process it, which in a way it was a really good thing, because I feel like I would have, like, just the waiting and waiting would have really like stressed me out. I didn't have that amount of time to stress about it. You know, me and Adam talked about it, and we knew it was the right thing to do for her, horrible, you know, as it may seem. We were like, right, okay. So because it was in London, we had to be in the hospital at 7 AM, we had to arrange a hotel and sort out our work and things like that. In a very quick, like 2 working days, we had to sort this out. So yeah, that was a very, very stressful time. Yeah, as I said, we knew it was the right thing to get it sorted as soon as possible. We just didn't expect it was going to turn out to be like, right, actually it is worse than you know, from this consultant, it's worse than I expected. You need to get this fixed ASAP. And so many things have run through my head. I can't believe this was missed. Like, so many things make me very angry about Isla being a COVID baby. And if you're a mother that had a baby in COVID, then you know the lack of support we got as mothers, our babies got. You know, her sickness was overlooked. She had GERD and no one did anything about it, and she's been suffering with these allergies for like 2 years, and the amount of times I've been to the hospital and the doctors about chest infections over the last few years, because I thought that was all related to asthma, but it could have been a heart. No one picked up this murmur, which I find astounded really, because the consultant let us listen on the stethoscope to it, and even I could, it was audible, you could pick it out, I could hear it very clearly. It's like you hear, so basically you hear this ba-boom, ba-boom, the heart, but underneath you hear a swoosh, swoosh, like a swishing noise, and it was quite distinctive. So how that was missed, I just don't know, because she would have had this from birth. How was it missed? Yeah, she wasn't a risk factor, she's not prem, but you know, I don't know, I'm really angry about it, like really angry, but I don't know, I feel like I just want to deflect my anger and frustration at somebody, rightly or wrongly. It does mean that any future children that I will have additional scans. As I said, it's not genetic, but there's now a risk factor there because I've had one child, so any other children I may have will have to have extra scans to make sure they don't have a PDA as well. The day of the operation, so they've explained the procedure and the operation to me quite a few times, but I feel like half the time I was just so like not with it during this process because it's just so overwhelming. So basically she had a cardiac catheterization, and it is this little mesh thing that they're putting the valve to basically block the valve really, because obviously the blood's flowing through and it shouldn't be, so they've just block it up so blood isn't going where it's supposed to. And they do this by putting a shunt up through the groin all the way up into the heart, so she doesn't have to have open heart surgery, thank God. The only time, one of the risks is if that may have to open up her heart if things go wrong, but it is keyhole surgery, which is less invasive and, you know, just great for her. So we got to the hospital at 7 AM, and because it was such a quick turnaround and it wasn't the hospital that we'd initially been going to, they didn't have any like pre-op scans, notes or anything, so we got there and she had to have an echo again, she had to have an ECG, and she was going to go under general anaesthetic, so they wanted to get an IV in and take some blood. But yeah, they had a very hard time getting blood out of Isla, and they attempted quite a few times when she was awake, and yeah, it was just causing her so much stress. They couldn't get it in, she was crying. It's the first time she's ever cried. She's had blood tests before, but she didn't even bat an eyelid, so that was hard. I was thinking this is going to get her really worked up already, and they just gave up, and they were like, we'll have to get the anaesthetist to do it when she's under, which they did. But even I can even tell that the anaesthetist obviously had quite a few attempts when she was under on the gas, and I'll explain that in a minute, because she has got quite a few bruises over her arms and her hand, like arms and elbow bits and stuff like that. Well, they've obviously attempted to get it in and they couldn't, so she is quite bruised on her arms and things like that from when they've attempted to get these in her veins, like poor soul. Like, so it came our time to go down to theatre, and that was an awful experience. Oh no. So we took her down to the room, and I sat next to the surgical bed, and I had her in my arms, and they basically had to gas her to sleep before they put her under with general anaesthetic. I think they do this to kids because, well, they couldn't get an IV on her. So they put the gas on, obviously, around her mouth, and oh, it was just horrible. I mean, the thought of your baby going under like that is really not nice. And then with this like gas, she was fighting it in my arms, like fighting this down, and they kept saying it's a very natural reaction, but it was like she was spitting in my arms, her eyes were rolling back. It was just such a horrible experience. And then I had to lay her on this bed and leave her like that, and it was just so horrible. And I just came out crying, and it was with Adam, and even though he was trying to fight the tears, it was just such a horrible thing to leave my baby there. And they tell you that procedures like this, they have to go through the risks, and they say it's so uncommon, anything will happen, this is such a common procedure, but you just feel like, what have I left my baby to? And the worst things go through your head. And it was just the most agonising wait for when the consultant came and found us to tell us everything had gone fine, and luckily it had. And she didn't have to have open heart, nothing's gone, the thingy didn't move, so it was really good. Again, going down to recovery and seeing her, she was just so distressed and disorientated, and I've never seen her scream or react like that, and that was horrible. And then she had to have another echo. She was just screaming and crying. We had to hold her down, and we were both scared we were going to hurt her because she's just come out of her procedure, and it was so distressing, like really, really distressing. But later on that day, she did have a nice sleep, and then she ate something, and she definitely was more herself. And she has been ever since. The doctor did say that sorry, it's been really overwhelming. Yeah, the doctor did say that kids do bounce back so quickly from procedures like this, better than adults, and she really did. So her recovery went well in hospital, and then she was finally discharged, and we're now at home, and she's recovering nicely at home, and we just got to wait now. We need to go back to London in a couple of weeks and have another echo with the doctor, just to make sure everything's in place and it's all looking good. As I said, she did have an initial one after the operation, but that was like an hour after she came round, which I think was just too soon for her. But this one is going to be in 2 weeks time. He emailed me today, the consultant said, oh, should we book one for 2 weeks? So I haven't actually got a date yet, but it should be in 2 weeks time, and then we can assess, or he can assess, how often she'll need to do it. But hopefully she won't need to have too many more, and then she can be completely discharged from this whole entire case. And that is the good thing with this procedure and PDA, though it can have its risk and it can be serious. Once the treatment's done, there's no long-term treatment, there's no medication, she can live a happy, healthy life like none of this ever happened. So I am grateful for that. So that is Isla's heart defect story. It's been crazy. This has all happened over the space of 2 months. Like, we found out she had a murmur end of July. Mid-August we found out it was a PDA, and now we're like September, and she's actually had the procedure done. So it's been a crazy, overwhelming, stressful few months, but I am glad that she is now recovered and on the mend, and I just thank all the doctors and nurses and everyone involved in her care and treatment. They've been absolutely fantastic. So yeah, do let me know if you have any questions around a PDA treatment in the UK, obviously, and I can answer some questions. Or if you just got like PDA questions and you live elsewhere, obviously treatment's going to be different around the world, and obviously everything I'm saying is Isla's treatment. It may not necessarily reflect your child's treatment, but I hoped that you found this video insightful or interesting. Please give it a like or a thumbs up if you did, and please subscribe to my channel if you haven't already. It will mean the world to me. I will see you guys in another video. Goodbye.